We're now on to our second panel discussion, which is on animal behaviour therapy. I'd now like to pass over to incoming fellowship chair, Dr. Chris Tufnell, and Ben Meyering from RCVS Policy and Public Affairs, who will be facilitating this panel discussion. This time on animal behaviour therapy. Is it an act of veterinary surgery and should it be regulated? Ben will be sharing the latest RCVS position on this issue and plans on regulation of wider veterinary roles, and Chris will be chairing the session, so over to you too. Thank you.
Thank you very much indeed, John, and thank you all for coming back after the break to this sort of graveyard slot, which Ben is going to fill. We will be rather hoping during this session that we end up with slightly more answers than questions. I loved this morning's discussion, but there seemed to be lots and lots and lots of questions, and it left me thinking that there were many, many more questions than I'd even thought about. So we're hoping for a few more answers, and if you think when you start making a comment from the floor when we get there that you're going to sound a bit strident and a bit certain, please do, because I think it will really help us to gauge people's opinion from around the room. Now, I'm actually going to retake my seat for a minute because I'm going to ask Ben, who's Policy and Public Affairs Manager, no, more accurately, the long-suffering Policy and Public Affairs Manager at the RCVS. Ben had to accompany me on a trip to India, and it's something that he has not quite yet recovered from. So I'm going to hand over to him. He's going to give us some background on why the college wants to know the answer to this question and the sort of tricky intricacies of regulating areas, not just such as this, but you'll get, I'm sure you'll get an impression from the starting introduction, other areas as well. So Ben, hand over to you.
Sure thing. Hello, everyone. So it's a great honour to be addressing such an esteemed crowd. I have to say, it makes me feel like I've got a degree of imposter syndrome. So I am not a veterinary surgeon, let alone a fellow, nor, in fact, am I an expert on animal behaviour. So at this point, you may be wondering, well, why on earth is he talking to us then? Well, the answer is that for some years now, we've been looking at the reform of the Veterinary Surgeons Act, and particularly how that factors into the regulation of the whole vet-led team. And I've got some slides here. I'm hoping this clicker works. So, so that's one part of my job. The other part is then, after we've developed those policies, is trying to persuade politicians that they should be taking that seriously and implement it in Parliament. My wife calls me a professional hobnobber. At least I think that's what she calls me. Okay. So, going back a few years, we started this process with a working party called the Exemption Orders and Associates Working Party, which was chaired by Dr. Bradley Viner, who I think is in the room somewhere. Right, Bradley. So we started this work because DEFRA asked us to look at the exemption orders, which are sort of minor bits of legislation that allow lay people to carry out acts of veterinary surgery, and I'll talk some more about that later. But one of the other major things that it took on was to look at models of regulating the vet-led team, paraprofessionals. It came up with two models. The first one was the associate model, which we already use to regulate veterinary nurses. So that's sort of the full-formed regulation, if you like, where the RCVS holds the register and is responsible for disciplinary and code of conduct and so on and so forth. So it's a very direct form of regulation. The other model that was proposed is the accreditation model, and that was much more distant, sort of a semi-skimmed model, if you like. And that would be where you accredit an existing voluntary regulator. The RCVS would do that accreditation and would say, OK, your standards, your code of conduct, and all of your procedures and so on are up to scratch, and we give you that stamp of approval. The purpose of both of those models would be to give full public assurance and also assurance to veterinary professionals, veterinary surgeons, that the people that they're delegated to are properly trained and so on. Over time, we looked in more detail at both models, and the accreditation model, we had some concerns about it. There'd be an awful lot of resources required to set up the governance and the staffing and so on of such a model. And we also had quite a few submissions, particularly to our legislation working party consultation, that said it's a bit too distant. There's a little bit, it's a bit too hands-off. There are some reputational risks with having that lack of control. So we decided, for the moment at least, to put that on pause and focus on the associate model. So a little bit of detail then about the legislation side of this and how that's underpinned. So that there are two, to roll back a moment. So the Veterinary Surgeons Act 1966, the existing act, one of the key purposes of that is to restrict acts of veterinary surgery to veterinary surgeons. But there are a couple of exemptions to this, or ways of getting around this, one of which is exemption orders, which I've mentioned earlier. So the purpose of an exemption order is to say that a very specific procedure can be delegated to a layperson, someone who isn't a vet, but that should only be something that only requires training measured in hours and days, say. So examples of that would be lay TB testing, or the de-snooding of turkeys is one of my favourites. I think the word de-snooding should be mentioned more often. So that's the kind of the minor measures, if you like. The bigger and more full-fat, again, way of delegating acts of veterinary surgery is the more Schedule 3 route. So that's what we use for veterinary nurses, who at the moment can carry out medical treatment and minor surgery. So that's when you're delegating a whole scope of activity to a whole paraprofession that's undergone usually years of training, like with veterinary nurses. So, two different forms of delegation. Legislation Working Party then. So this started in 2017 under the chairmanship of Professor Stephen May and finished its work in 2019, I think. And this built on the work of the Exemption Orders Working Party, which we mentioned earlier, but was a much deeper and broader review. Looked at every aspect of the Veterinary Surgeons Act, biggest review since 1966, and gave recommendations on a whole suite of things from disciplinary through to mandatory practice regulation, limited licensure, all sorts of things, but it built on those recommendations around the models for regulating the vet-led team. And the final recommendation was that the college should become the umbrella regulator for the whole vet-led team, particularly anyone who's carrying out acts of veterinary surgery, as we've been talking about before, in that the associate style, Schedule 3 style veterinary surgery. And included in those are cattle foot trimmers, equine dental technicians, musculoskeletal therapists. We've also been looking at vet techs too. And that would be accompanied by statutory powers, so protection of title, we talked about that earlier in the context of veterinary nurses, and also flexible powers of delegation, so that as evidence changes and progress is made in various fields, the RCVS itself would hopefully have the power to determine what can be delegated to paraprofessionals. And then from a policy perspective, therefore, the people that we've been focusing the most on, the paraprofessionals who we've been talking to the most, are those whose work involves acts of veterinary surgery. So I keep talking about the vet-led team. So what is the vet-led team? People have been talking about this concept for years, but without really a definition. Now, Dr. Tufnell gets very frustrated when people just read off slides. It's very soporific and implies that you can't read, so I won't read off this definition, but this is the one that was come up with by the Legislation Working Party. And I think the key word there is direction. That's what makes it a vet-led team, is that while the vet isn't doing all the work, they're, in a sense, at the centre of things. They're directing work to allied professionals as part of that vet-led team. And if they feel that it's appropriate, they will carry out a clinical assessment prior to that delegation. So that's the context. Acts of veterinary surgery, vet-led team. When we were talking to these various paraprofessionals, one of the earliest groups that we spoke to were the behavioural therapists. They were interested from a very early stage. And one of the main groups among them that we were talking to is the ABTC, Animal Behaviour and Training Council. Now, they're one of the voluntary regulators that I mentioned earlier on, who've been doing good work in this area. And they regulate a number of different professionals, from the clinical animal behaviourists, who are very highly trained and doing the clinical work, as the name implies, through to animal trainers, dog trainers and so on, who perhaps aren't doing the clinical work. So that's some important context to remember with this particular group. But when talking to them, a number of difficult questions were raised. And I'm going to sort of explain these questions. I do not have answers to these questions, which is partly the purpose of this session, is with the hope that maybe you do. We're going to be putting a working party together under the auspices of the Fellowship Science Advisory Panel to try to address some of these questions and give recommendations to Council. And I'm hoping that if you're inspired by this discussion, that some of you may volunteer to join that working party. So the first question is animal behaviour therapy an act of veterinary surgery? When this was first presented to me as an idea, I thought it doesn't sound right, but then, as some have argued, it does impact the physiology of the brain in a deliberate way. So unless you're a dualist, i.e. somebody that believes that sort of mind and spirit is totally separate from the body, as opposed to a dualist, you do accept that when you're deliberately changing someone's behaviour and the way someone's think, you're actually influencing that squidgy grey matter. I'm not sure that's a technical term. There'll be people in the room that know better than me. So there is an argument there. And one of the voluntary regulators has pointed out, and again, I'm in danger of reading a quote out here, but in fact, I'm going to do it, that veterinary surgery, the definition of it, should include an activity that affects the mental health of an animal as well as its physical health, such as occurs during behavioural counselling and training. And they would also make the point that animal welfare legislation, the Animal Welfare Act itself, does talk about the suffering in terms of the mental health of an animal as well as its physical health. So there's part of the question, but I think if you accept that deliberately changing something's behaviour does affect it physically and therefore is potentially an act of veterinary surgery, is that any different than if you're training an animal where you're deliberately affecting its behaviour and so on? Well, this is just sort of a spectrum, if you like, which comes on to the next problem, which I call the holistic problem, because I think it captures it quite well, and also because I'm quite pretentious. So how do we break this down? Now, ABTC in particular argue that you cannot do that, that it is all part of one continuum. And they make the point that the trainers are in many ways having a bigger impact on animal health and welfare in the long run, particularly when you consider the number of animals that they'll be dealing with as opposed to rather fewer numbers of clinical animal behaviourists. And that also, it's also a matter of public health too. So a properly trained dog shouldn't be attacking and injuring, for instance, a member of the public, which is, I think we'll all agree, quite important. So that covers some of those key questions that have been raised by this. And as I say, we're going to be putting a working party together to discuss it. What we're hoping is that there'll be going to be some people in this room that have views on some of this stuff, both those scientific and philosophical and practical questions about, is it veterinary surgery? Can training roles be separated from clinical roles and so on? But also, what are your thoughts on how important regulation of this particular paraprofession is? Maybe you've got experience of delegating and referring to them with positive or negative outcomes and so on. It's probably enough for me for the moment.
Brilliant. Thank you very much, Ben. And make no apologies for his dry sense of humour. We have a dry sense of humour competition. Essentially, this afternoon, we're going to hopefully get as much comment from the floor as we possibly can. We've got Deborah there and Chloe here with microphones. And what I will try and do is, whilst one person's speaking, I will try and choose the next speaker so they've got an opportunity to get to them with the microphone so that we can keep things going. It will be worth people giving their personal experiences just to illustrate some of the problems that we've been talking about so far, because it gives it so much more context. And I'm delighted to see Gemma here. We've got some specialists in in the room. And Gemma has saved me from injury. So she introduced herself earlier, but she's written some very practical stuff. I'm an equine vet in a mixed equine and small animal practice, and it is the most dangerous civilian role, being an equine vet. And the techniques that Gemma's done work in terms of modifying behaviour and equine learning has genuinely saved me from injury. So there is some real importance there. And I've also spent 24 hours in a hospital from being bitten by a dog whose behaviour really wasn't acceptable. My experience of behaviourists has been very mixed. There are some very good people out there who have almost no qualifications at all, and there are some people who have a lot of qualifications, and my small animal colleagues tell me that there's a difficulty working with some now because they are starting to medicalise everything and want certain animals to be put on certain behavioural modification drugs, and vets' lack of knowledge in some of the areas involving behavioural modification drugs isn't helping, and there's a tension there with the relationship. And after over 20 years in equine practice, I now think there is an incredibly small number of animals with a behavioural problem that isn't related to some form of pain or discomfort. Now, I may or may not be right, but that certainly appears to be the case, the transformation in an animal's behaviour when you've isolated what it is that's causing it the problem. So I'd be really fascinated to hear people's personal experiences that might illustrate the trickiness of this area, but also obviously their views on whether this is something we should be closely involved with, and whether we can split training, which arguably is preventative treatment on the brain, and from therapy. So who'd like to kick us off? Brilliant. Chloe. Gemma's going to kick us off, which is excellent. Keep putting your hands up, and then I'll go. Deborah.
Thank you. I'm going to make 3 points, the first 2 very quick. So I'm really interested that you're calling it behavioural therapy and not behavioural medicine. We now have a European college which you can become a veterinary specialist in behavioural medicine. So it is a discipline within itself. And second point, the ABTC are really enthusiastic. They started off from a training perspective. They've now moved into behaviour, but they don't have anyone on their board, or trustees or anyone on council which actually has any specialism within behaviour. And I think that's a massive limitation, and that's why you're getting some of these answers back, which I think a lot of vets that specialise in behaviour would disagree with. You wanted a kind of personal perspective, and so I'll give you mine. I offer a clinical equine behaviour referral service out of the University of Edinburgh, and my caseload, I would say, is split into 3 areas. About 70% of them are horses which present with behaviour problems that actually turn out to have an underlying pain cause, frequently musculoskeletal pain. And I think we need to remember that, if a horse is aggressive, this is a behaviour that may be preventing it from being in further pain, in the same way that lameness is a behaviour that limits the amount of further pain. Another 20% of them would be horses whereby there is actually some, I'll go as far as to say, pathology or disorder within the brain. So maybe an animal has a particularly stressful experience, or there's something which has happened which means that they've got wind up of this stress response. And so that is where we do need to consider treatment with a psychopharmaceutical to restore a kind of normal homeostatic balance. We wean them off and the animal can hopefully go on and have a happy life. Then the other 10% is actually the cases like you were saying, where potentially you've got a needle-shy horse and you just need to do a bit of behaviour modification, which is essentially training, changing that animal's emotional state to be able to inject that horse. But I would say there's only 10% of the ones I see now, and whether, even trailer loading, my trailer loads, I'm now trying to trot them up and flex them, because the majority of them, the horses not want to load and travel because of pain. There was a webinar just last week it's actually one that's run through the Horse Trust, and they have non-vet behaviourists and vet behaviourists presenting cases. And I thought it was interesting that they had a case. It was a horse that had been orphaned and then hand-reared. There were behavioural problems as an issue of that. But it also had sweet itch, and they were using scratching it as a form of positive reinforcement rather than food, which it was very aggressive with. And at the end of that, they kind of went, well, this pony was going to be euthanized. It's now manageable, but it still has really good days and bad days. And I thought, but no one's got this horse's sweet itch under control. And, you know, an itchy pony is not a happy pony. And actually, I'm all for having non-vet behaviourists, but we need to think really carefully about what they can and can't do and how we regulate them, because that should be working with a vet that could treat the sweet itch, and I think we'd have a much happier pony.
Brilliant. Thank you very much indeed. We'd go over here, please, and then Chloe, there's one at the back there.
Yes, thank you. I'm sort of coming on really perhaps to a European aspect really of this, because the Federation of Veterinarians in Europe, in conjunction with FEVA and Vicava and the WSAVA, put out a joint paper just recently on this subject really. I'll read out the title. I've got to read it. It's the Joint Position Paper on the Animal Welfare Implications of Animal Behavioural Modification, Training Methods and Ability to Express Species-Specific Behaviours. And it goes into quite a lot of detail over about 12 pages. And there's about 12 recommendations. The two things that I'd like to take out of this paper is the fact that first of all, they mention an awful lot about undergraduate veterinary education in behaviour. And I don't know how much behavioural medicine is taught in the veterinary schools now, because certainly when I qualified it was virtually zero, I'd have thought. But it was going on about the range of friendly handling techniques, learning theory, advice on the pros and cons of different training methods, recognise normal and abnormal behaviour, behavioural first aid, and where to refer. So quite a wide range at undergraduate level that they're recommending. On the behavioural side of it, they talk about accredited clinical animal behaviourists as well as veterinary animal behaviourists, and therefore that's where we come into the non-vets involved. And they talk about the accreditation of animal behaviourists, and also they do mention in the paper, in fact, the work that the college is doing at the moment, and of course, as already been mentioned, the Animal Behavioural Training Council. So I think my point is that whatever the college decides from its working party next year, I think that perhaps ought to take into consideration that other people are looking at this in a wide European base, and that any sort of accreditation or training for accreditation should be wider than just the UK, simply because of the number of vets that we get across the borders.
The case for global Britain. At the back there, please, and Deborah.
I'm Rachel Casey, veterinary behaviourist, currently working for the Dogs Trust. I completely agree with everything that Gemma has said in terms of the importance and how integrated behaviour and veterinary medicine are. We really, and in answer to your questions up there, I think it's absolutely fundamental for animal welfare that this sector is regulated. So obviously I work in the charity sector, and we end up with dogs coming into our care regularly with complex and difficult problem behaviours that we have to spend a lot of time and money to go through rehabilitation programmes, largely because members of the public are misinformed about how to train and look after their dogs in terms of their behavioural needs, their basic training and any kind of behavioural modification. And they get poor advice from all over the place, including the veterinary profession, but largely from unqualified, poorly regulated trainers and behaviourists. So I think it's absolutely fundamental for animal welfare that this sector is regulated. It makes absolute sense for the RCVS to do that as part of the vet-led team. And can training roles be separated from clinical roles? Yes, absolutely. I'm a member of the ABTC, so I respect their views completely. But the ABTC have role standards set out. So there's a veterinary behaviourist, clinical animal behaviourist, animal training instructor, animal trainer. So it's really clear within the ABTC that those roles can be separated. So for those roles that need to work on veterinary referral, so the clinical animal behaviourists, I think, can absolutely be separated out from the trainers. And I think that would be a sensible and pragmatic approach to regulating part of the field, at least in the short term.
So, sorry, can you hang on to just to fire it back at you, I understand that you think that it can be separated as roles, but arguably the trainers are, from what you said earlier in your point, are as if not more important than solving the problems once they've arisen. So how do you protect the public and their animals from trainers that, if we don't regulate them, if we don't hold them to some standards, how do we protect them from trainers, people putting themselves out as trainers and doing the job badly and causing more problems? Yeah,
and I agree. I'm sorry, I sort of probably didn't explain myself very well. I think in an ideal world, it would be great to regulate the whole sector. Pragmatically, it would be good to regulate some of it. So, yes, absolutely. The ideal world is that we regulate trainers as well as behaviourists. But I do think the roles can be separated out if that's a necessary part of regulation. But yeah, I think the poor training advice is the biggest reason for, we know we've got data that tells us that the biggest reason for euthanasia of dogs under 3 years of age is behaviour problems. The biggest reason for behaviour problems is people not understanding how to train their dog, not recognising early signs of problem behaviours, and then not taking appropriate advice when they do see those early signs. Brilliant. So it's absolutely fundamental, in my opinion, to us as a profession.
Fantastic, thanks very much.
Can I follow up further too before you lose the mic? So do you think, I understand the argument that there should be regulation across both roles. Do you think there's more of an argument for the RCVS to be regulating the clinical animal behaviourists than the trainers, that maybe voluntary regulation is sufficient for the trainers, but there's more of a case for that kind of clinical role to be RCVS regulation?
Yes, because it becomes onto that vet-led team. So I think there is an argument for RCVS to regulate, a very strong argument for RCVS to regulate the team that is involved in the treatment of animals. There's less of an argument for those that are involved in prevention, but I think it's important for somebody to regulate it. And I think we're in a position in terms of the government that they're very unlikely to do so. So, you know, if for animal welfare reasons, if RCVS could look at regulating the whole sector, I think that would be a real positive. But regulation of the behaviour role would be a good step forward.
Brilliant. Thank you. All right, Ben. Stuart.
Royal Veterinary College principal most of the time. Ben, thanks so much for your presentation. Outstanding. It's a shame you don't qualify for Fellows of Tomorrow. Two things. The first one is, I understand last weekend the Association of Veterinary Students met in Liverpool, and there will be some behavioural modification required for some of those individuals who attended. Now, I'm half in fun, whole in earnest here, because what's the model from the human world? I mean, we've got psychiatrists, we've got clinical psychologists, we've got the general practitioner, we've got therapists, we've got counsellors, we've got teachers, if you go back as far as training. Right. So how does it fit? I don't know the answer to that. So how does the medical world approach it? Is there an umbrella? Do they each have individual accrediting bodies, or how does it work?
There's more work to be done on that sort of comparison, but it's quite fractured, is my understanding. There are different regulators for different roles, and when you get down to the people like psychotherapists and so on, where it's voluntary regulation, again, there are competing bodies, which then creates potentially a confusion or a lack of assurance for the public. So there are definitely parallels between the two. What we're trying to achieve with the regulation of the vet-led team as an umbrella regulator is perhaps in some ways better, more coherent than the current situation in human healthcare, where it is very fractured. Whereas if you have the vet-led team regulated under a single umbrella, under a single governance structure, you can make sure that the delegation regime, that all of those, everything's coherent from the code of conduct through to those delegation protocols and so on. It's easier to achieve under a single regulator, which I don't think they'll ever achieve in human healthcare.
I realise I've lost the microphone, but thanks. But I think the parallel, or the one that concerns me most, if you take it back as far as the trainer, I mean, that is the parallel there is the teacher, and surely we can't be thinking about that. Or maybe we are.
I'll come to you and then...
I think that is a good point. There's a distinction between clinical roles and educational roles. And thus far, it's not clear to me that there should be any... that there's a difference, that's different in animal health and welfare. I don't understand why it's singular in that respect. But I'm open to being convinced.
Okay. First, please.
At Texas A&M. So I actually think the idea of regulating the behavioural therapy makes really good sense, particularly even with a model where if a person was a behavioural therapist, they were actually specifically under the direction of a named veterinarian. I do think, though, talking about regulating animal trainers is a step way too far for the Royal College. I don't think we need to be involved in regulating or registering animal trainers. Next thing, it'll be dog groomers. And then, I mean, you just got to think there's a point at which if this is a pretty low-key position, I just don't think the Royal College needs to be involved in things like, so the dog trainer, I would not include that in the argument at all. I think if it's a task that a person can do with their own dog in their own home, or they choose to pay somebody else to do it, we do not need to be involved in that. I completely respect the idea that behavioural issues are an enormous part of animals being handed over. I completely understand that, but I don't think we should be involved in regulating routine dog trainers. It just seems to me too much.
Okay, thanks, Audrey. Peter, and I've got another one there, and then Chloe. Do you mind over here for a sec? Sorry.
Yeah,
Peter.
Peter Orpin. Just speaking really as a practitioner, I mean, just standing back from this and linking with what we talked about this morning, the major area of sort of animal welfare concern lies with the animals under the ownership of the general public, and I just wonder whether we should focus more of our effort not on regulation, but actually on sort of advice to animal owners in terms of what they need to do to actually get their animals trained, and that might have a greater net benefit than the incredible focus on just the very small proportion of animals that actually reach the animal behaviourists or trainers. I think there's the great unwashed that we've got to sort of look at, and I wonder whether that's what we should sort of focus our energy on. And it worries me that the difficulty of trying to define exactly what these roles are, I'm not certain how easy it will be for you to regulate it when you get there. And that's what I'm concerned about. Are we not going to step into a territory which is going to be very murky and very tricky to actually regulate in any event? So I'm not trying to undermine it in any way, but I just see it as difficult.
Those are the comments we need. Dick, you're next, and then over to you, Brad.
Yeah, thanks. Really, for the sake of the debate, it's not a view. I'm totally open-minded about all this, and I have every respect for these organisations. But the Royal College role, you have to look at what we're here for. And are we here to protect animal welfare? Yes. Are we here to protect the public? Yes. Are we here to create protectionism? And we have to be careful that we're not creating a protected environment for various professions so that those that are already in it basically secure themselves what we respect and enjoy. We enjoy, as veterinary surgeons, protection from people setting up against us financially in a business world. And we have to be careful that we're not getting sucked in to something that really is nothing of our concern.
Yeah, thanks very much. Bradley, there's several over here. I'm keeping an eye out. Deborah, could the mic come over there, and then we'll up at the back, please, Bradley.
I think it's important that we understand what we mean by regulation. The Royal College regulates the veterinary profession by statute under the Veterinary Surgeons Act. It regulates the veterinary nursing profession by charter, And it does that through Schedule 3, where it has subsequently decided that veterinary nurses can be associate members of the college. It also deems that only people on the list held by the Royal College can carry out Schedule 3 procedures, so it has a control in that sense. But there is no control, as we've already heard, in terms of title. If that membership, associate membership, is withdrawn, then actually that person can still carry on doing non-Schedule 3 tasks within the veterinary practice legally. And indeed, although the college tries to regulate it through its code, legally they could continue to call themselves veterinary nurses.
I'll come back on this.
As to what we could do with behaviourists and where it would fit into that scheme, we could, within our existing structure, create a category of associate membership that was designed to incorporate behaviourists. And what that would mean would be that we would effectively be giving an RCVS stamp of approval to those people who were associate members, but it wouldn't stop other people doing a similar job. So what it would mean is that it would create a route in which veterinary surgeons, and particularly veterinary surgeons, but others as well, could readily identify people who are under, and there are other examples of charter accreditations, that person is considered to be of a particular standard, and that if they don't perform to a pattern of professional behaviour, then they can be removed from that sort of charter function. So that is a form of regulation, but it is very different to how a veterinary professional is regulated. And realistically, I think there's very little chance of the government creating an equivalent either to the Veterinary Surgeons Act or within a new Veterinary Surgeons Act, which would give, a protected title in the similar manner to veterinary surgeons to behaviourists. But in terms of where we draw that line, I don't think there's too much problem, again, taking the human parallel with dealing with those who deal with clinical disorders from those who are dealing with training. It would be like psychiatrists and psychologists and psychotherapists. I don't think that's the major stumbling block.
Okay, so
thanks. Can I follow up on that? So the legislation working party proposals are that we should have that statutory power to upgrade the veterinary nurses from the Royal Charter regulation that we have them as now, as associates, through to something that looks like the associate model, but that's underpinned in primary legislation, and that would give that protection of title. So at the moment, as Bradley's indicated, I'm not a veterinary nurse, not a registered veterinary nurse, but I could call myself one. I only do so at the weekends. But this would change that. This would prevent that from people from being able to misuse that and claim a title that they're not trained for. And we're looking at having the ability to add other paraprofessions to that same scheme with that Schedule 3 equivalent underpinning that allows them to do acts of veterinary surgery. And we've spoken to DEFRA about this, and they seem quite keen on this aspect of it. Again, I mentioned some of the paraprofessions, particularly musculoskeletal therapists, cattle foot trimmers, and so on, because if those titles are protected and you have the more freedom to delegate to them and that public assurance and confidence to delegate to them, that frees up vet time as well, right, to focus on the things that only vets can do. And it's good for the careers of the paraprofessionals, gives them more robust careers. So they should get a bit of a virtuous circle there. The difficulty is with something like behaviourists, where it's not clear whether they're doing veterinary surgery, so should we be regulating them? But if we conclude that it is, then potentially they could have that statutory regulation as well, which we could add using secondary legislation rather than primary.
I grabbed it back. We could set up an associate membership category for animal behaviourists now, and we could get the ball rolling, because we all know that a new Veterinary Surgeons Act could be in totally indefinite time in the future. And by establishing that category of associate membership and giving our blessing, if you like, to a category, a subcategory of people involved in animal behaviour, we would start to create a precedent which maybe in the future might make a more statutory-based regulation more likely.
We could, one more. So we could. So that's the accreditation model that we were talking about earlier. But there are disadvantages with that because it's relatively hands-off. There's less control, which has reputational risks. If you decided to take away that accreditation later, it could cause issues and could cause confusion. It's difficult to just accredit a body like ABTC, for instance, if you wanted to only accredit them for some of the people that they regulate as well. It's another area of complexity. And also the practical difficulties around it are quite substantial. You would have to put in place quite a lot of sort of staffing and resource to put that together, to have an accreditation scheme. And at the moment, we really only have one candidate for it, which is ABTC. So the cost effectiveness of setting that up is in doubt as well, which is why last year Council decided to put that on pause for the time being while we focus on the legislation working party side of things. But it's not totally off the table, and it is something we could look at later on.
Right. Can I come up there? I've got you at the back, and you'll be off to Emma here. Yes.
Thanks, Chris. Simon Wheeler, I'm a neurologist. I'd like to go back to the what rather than the how, which has, I think, been the discussion in the last few minutes. And I totally support the idea that it should be behavioural medicine, not behavioural therapy. And you asked for some personal experience. When I started practicing, and I emphasised practicing neurology back in the 80s, it may seem amazing, but we had no way of imaging the dog's brain. And we used to get dumped cases which were behavioural problem dogs with the referral, this dog must have a brain tumour. And the only way we had of deciding whether they had a brain tumour was the good old neurological examination. And I think if we worked on the basis of which cases were sent to us having brain tumours, every Rottweiler in the country had a brain tumour, and were probably managed appropriately. We were lucky that we had a couple of people we could refer with behavioural problems, and I've been very happy over the years in referring non-organic brain disease to people who could manage those cases. The other side of the coin, a good friend of mine who used to practice in California used to get eminently frustrated by animals that had behavioural problems that went to see a behaviourist and were put on pharmacological therapy that actually then turned out to have completely manageable organic brain disease. So I would say there's a continuum here. And behavioural medicine, to me, is part of the continuum of veterinary surgery and should be managed managed in such a relevant way. So I think the proposal, the how is not for me to comment on, but the medicine I feel very strongly is part of our remit, and I'd be very happy to be involved in any working party that ever comes about. So.
Brilliant. It's that sort of volunteering that I'm fully in favour of. Deborah, at the back there, and I've got Emma over here. Yep. Yep.
I'm Emma Milne. I'm not a specialist in anything, which I think is a strength in itself. And I always love to take things back to basics. And I think I do a lot of stuff about extreme conformation and behaviour and nutrition and ethics and welfare. And I love the model of the 5 welfare needs. And I view them largely as 3 physical needs and 2 mental health needs, which is the social interaction and behavioural needs. And I think that we massively underestimate that. And I think that the whole regulation thing is, in a way, it's a second issue. We have a massive problem with people picking inappropriate pets. And we've created dogs over thousands of years that we've given them a genetic ceiling of behaviour in some ways, that people see a film that Disney puts out, like about sled dogs or something, and then they all buy a husky and they don't understand why that dog rips their house to pieces. Or the fact that people buy a brachycephalic dog because they've heard that they don't need much exercise, which is like saying that if one of my kids broke their leg, they wouldn't want to go and play in the park, even though they are just incapable of doing it. So I think this is actually a much bigger societal problem, and we should be tackling it at the base. Is not how do we regulate trainers, which we absolutely should do, and behavioural medicine, it is medicine. I completely agree with everyone. I'm a big fan of Sarah Heath. It is medicine. But we need to be looking at how people acquire pets in the first place, because that's the baseline. And we need to be looking at the animals that we're creating in the first place that are going to go, we want animals to be good-tempered family pets, whether they're whatever species they are. And we're talking mostly today about dogs and horses. And the way we keep those animals is fundamentally, in a lot of cases, opposed to their general mental well-being and welfare. And I think we need to go all the way back to the beginning and start to look at how we can make people prove that they can look after an animal, that that animal is appropriate, and that we're not producing animals that can't live a happy life.
Emma, can I just stick with you just for 1 second? It's a little bit like the discussion we had earlier on animal training, because, as you say, you've taken it back to appropriateness of certain pets and appropriateness of certain owners, actually. Is that a role for the RCVS?
Personally, I think that the veterinary profession should be much more outspoken about this. I think we tread on eggshells all the time around breeders, particularly around owners. And I know we have to be diplomatic. And quite often as a first opinion vet, if you're presented with a puppy for a first vaccination, they've had hours with the breeder often. They've got homeopathic vaccines, they're feeding raw food, and you have 10 minutes, maybe 20 in a good practice, to refute everything they've been told. So I think we should be much more, as a profession, united to say this isn't okay. You, whoever it is, you're not able to have this animal as a pet. And I come back to the fact that, and this sparks all ethical discussions in other areas, but having a pet isn't a right, it's a privilege. And if you can't prove that you have the means to provide for those, and I know people's circumstances change over time, so of course we have to understand those things. But at the outset, if someone says, I am going to spend £3,000 on this animal, but I have no idea how to look after it, I can't actually meet any of its 5 welfare needs, I don't know what any of those needs are, that's the baseline problem. And I think we tackle a lot of the behavioural problems later by not having those people having those animals in the first place.
So arguably a role for the professions rather than the role for the RCVS. Yeah. So one at the back there, and then Chloe, can you just go there, please? Yeah, that's it.
My name is Angelica. I'm a reproductive specialist, so that feeds quite well into what you've just said. And if you want to know what happens when a profession is deregulated, you just look at my profession. 5 years ago, there was Gary England and myself. Now I have about 800 colleagues in the UK running fertility clinics. They call themselves reproductive specialists. They take progesterone, although they're not allowed to take blood. They do ultrasounds, they do artificial inseminations, and the first time a veterinary surgeon sees that animal is the cesarean, and it's the cesarean of the American bully that they can't pay for. And that was produced in garages and living rooms all over the UK. And I've been in touch with the Royal College of Veterinary Surgeons. They tell me it's an issue for trading standards. The problem with trading standards is there's hundreds of trading standards because they're locally based, and there's no national way of regulating these fertility clinics. When I call myself a reproductive specialist now, it's a joke. Yeah, I almost feel I would like to have a different title. I get videos sent of ultrasounds, of semen evaluations, of birth. Can you give me a hand? Can you let me know what you think, mate? That is the level of my professional standing after these fertility clinics have opened.
So obviously hugely sympathise with your situation and the general situation, but it's a frustration I say, I'm no longer on council, but the RCVS has, is that we regulate the veterinary professions and not those that aren't in the veterinary professions, but and the ability for law enforcement to do their job and enforce the law sometimes frustrates us all. I do know that the RCVS plays a very keen role in trying to assist those enforcing the law. But no, that's a really good point, well made from another area. I've got one here, and then we'll come up there. Thanks.
Yes, thank you. Very, very interesting discussion. And I'm just going to follow on what Emma said earlier. I'm Mike Jessup, South Wales based. I spend most of my days now in helping local authorities inspect, enforce and prosecute puppy farms in South Wales. And if you think it's bad, it's even worse than you can ever imagine. It's grim out there, and the quality of breeding of puppies is dire. The socialisation, the enrichment, the help that these puppies have before they leave the breeders is absolutely appalling. And unfortunately, our colleagues are out there advising these breeders. They're going into these places, they're passing these animals fit to breed because they only do a physical examination. And the veterinary profession has got to start understanding that mental health is a very important aspect.
Thank you, Mike. That's a really important point. Up the back there, please.
Hi there. Can you hear me? Paul Higgs, internal medicine specialist and chief veterinary officer at CVS. So I'm just going to feed back really to what Angelica was saying there in a sort of slightly similar way, which is, I mean, I'm fully behind the regulation of anything paraprofessional that has potential to impact on animal welfare, and I think behavioural medicine would fit with that very clearly. I suppose my concern would be is when we're talking about undertaking a regulation, is that are we in the right position to be able to provide the rigorous accreditation that needs to accompany that? And in terms of how we regulate that, do we have our current process, is that fit for purpose for these paraprofessional, clinical skill sets? Are we in the right position to be able to do that? Or are we actually in a position where we're going to be potentially accrediting and regulating something that we don't have the framework in place to be able to regulate? I don't think it's just as simple as saying, should we? I think it's a question of, are we able to, and what's that going to take?
Could I just come quickly on that?
Do you want to come back on?
We're in a similar situation to what we were with equine dentistry 20 years ago, whereby the vets were going, oh, we're not sure about this isn't our area, you know, they're fine taking sharp enamel points off. And now equine dentistry is, you know, it's got its own European college. We do it to a really high standard, and we were able to successfully regulate the equine dental technicians that are non-vets that come in that are now they are restricted in what they can do, and quite rightly so. They shouldn't be widening diastema. And I don't think it would be that hard to say, this is my personal opinion, obviously, but, you know, this is an act of veterinary surgery, and there will be some allied professionals, and we're just going to say this is what they are limited to do.
I absolutely agree with that. I'm not against it. My point is more about, are we ready for it? And when we're talking about regulation, it's not just about can we determine what the right thing is to do, but do we have a monitoring process in place? How do we know that the people that we are accrediting are actually following what we're determining to be the correct behaviours? Because regulation currently it relies on people reporting if something is not being done in correlation with what we're setting out to be those regulations. And so how do we get to a point where we have the appropriate monitoring frameworks in place for something, you know, that is currently outside the remit of our regulation?
Are you okay if I come back on that?
Just 1 second, Ben.
Yeah, there's a number of ways that you could come back on that, but it would, in many ways, just be mirroring what we already have for vets and more specifically for veterinary nurses. We already know how to do it. There's a template for regulation that applies across all professions in terms of holding a register, having a code of conduct, having the disciplinary process, and so on. And that whole system can be rolled out for additional allied professions as well. So while there may be concerns sometimes about how that works for different professions, there is a template for it that can be used elsewhere, and it would, whatever deficiencies there may be with that, it would be better than at the moment where it's a total sort of chaotic situation where anybody can use a professional title, where there's no agreed or accredited form of education, and if you are sort of struck off by a voluntary regulator, well, it doesn't make a difference because you just carry on practicing, carry on using that professional title. That bit would change if we got the kind of statutory regulation for other paraprofessionals that we're talking about. The tricky bit, a part of the tricky bit anyway, is making sure that you bring in enough experts at the beginning who already understand. Like, some of them are in this room, but some of them would need to be grandfathered in onto the new councils and so on to make sure that you've got the right people when you're drawing up those day one competences for the role. Sort of defining the roles and the titles, drawing up the day one competences, putting those procedures in place. But the template for regulation is already there, and the RCVS already does a very good job at it.
Great, thanks, Ben. Yeah.
I was just going to add to that as well that the ABTC, I mean, the issue with the ABTC is that it's a voluntary council, but they do have good standards of regulation. So there are well-defined role profiles for all of the different roles. There is a disciplinary procedure. It's actually an overarching council which regulates a number of member and accrediting organisations. So there is something which could be moved across that the RCVS could pick up that is already there, that has been set out by the ABTC. But the problem they have is that because it's voluntary, as has just been said, there's no way of controlling those who are not part of ABTC.
Great. Who's next? Have we got anybody else who wants to comment? So we seem to have got somewhere we're getting some answers, Ben.
Yeah.
Where are you?
Some really useful stuff there. Some good food for thought, particularly around how behavioural medicine is a thing, and we need to start narrowing down some of that terminology, and that perhaps we can make that distinction that we were trying to sort of tease out at the beginning between the educationalist side of things and the clinical side, and that perhaps is an argument for a different threshold for regulation there. Lots for us to think about. But as I said at the beginning, we will have a working party that will dig into the details as much as possible on this. We've already had one volunteer.
Yeah.
Anybody else? We're going to hold you to that as well. But anybody else? I count at least 3 people in the room. This is exciting. 4. So yeah, brilliant. We're going to. Too many.
Thank you. Amanda Bogue, Chief Medical Officer of IVC Evidencia. And actually my own dog had behavioural therapy and needed prescriptions. He got to the point where he was so phobic of rain, he would start peeing and scraping the floor even when he heard just a raindrop, and we had a treatment through the Royal Veterinary College's behavioural referral service many years ago that did a jolly good job with him, so I've had personal experience with my own animals. One of the question I wanted to ask really is a fundamental question in terms of the legislation, not whether animal behaviourists are making a diagnosis. Because if they're making a diagnosis, that is what veterinary surgeons do. That's the kind of core part of the Veterinary Surgeons Act. So is it some of it that we're having a transition from recognising, we've talked about this a little bit, that health is about more than just physical health and mental health in our patients as well? And do you have a view on whether the clinical animal behaviourists are making a diagnosis, in which case we would need to be mindful of not treading into criminalising people who are doing a valuable job?
It's such a good question, and we could probably do a whole session on that, actually. What's the distinction between an assessment and making a diagnosis? And sometimes we try to sort of square that circle a little bit with allied professionals to say, yes, they're doing an assessment, but it isn't diagnosis because diagnosis is reserved in law to veterinary surgeons, so it can't possibly be. But there is some kind of continuum there, and that's certainly not just a thing with behaviourists, it's a thing with plenty of other allied professions as well, and indeed veterinary nurses. But yeah, answers on a postcard on that one.
So we've got a few more minutes, and I'd just like to lead it on just a little bit and come back to sort of Emma's point, which is not so much necessarily for Ben and his team, who'll be pleased to hear, but as a learned society, a learned body, we should really be maybe thinking about this, what is effectively communication of science to the public. And I'd be really interested to hear from people where they think responsibility lies on putting those things together. Is it down to our professional bodies such as BSAVA and professional bodies like that, or BVA, or is it down to us just as individual veterinary surgeons and the professions and veterinary nurses? Anybody got opinions there as to who should be holding responsibility for that? One here and one at the back, and then back to Jade. Come to you.
There was a little bit of talk some time ago that, going back to Emma's point, that before buying a dog, you should have some sort of training in order to be able to look after that dog, and that it sort of brings us back to the old dog licensing thing, whereas at one stage, if you owned a dog, you had to have a dog license, and therefore you could work around the aspect that if you wanted a dog license, then you had to go to some sort of course, approved course, to show that you knew how to look after that animal. That's got nothing to do with the RCVS, probably, apart from the fact that members of the RCVS would probably be ending up running some of those courses.
Deborah, can you bring it over to Jade? And yes, up at the back there, please.
I would like to pick up what you said about when owners pick up puppies, for example. They've had so much rubbish, I cannot describe it any other way, about L2, L4, raw feeding, halters. The amount of very unqualified information a new puppy owner gets is overwhelming for a veterinary surgeon, and you start to sound like somebody who's putting everyone down and is trying to sort of reverse everything they've now taken on board and are trying to do. And I think the Royal College could have a bigger role in having more advice, and they could maybe team up with things like the Kennel Club, where a lot of people get information about puppies, or other organizations that are in touch with people that are looking for puppies and that are trying to bring them up properly. And there are so many new puppy owners now that it really is quite overwhelming for veterinary surgeons in practice to have a 10-minute consult or 50-minute consult and try and teach them everything or tell them everything about how to raise a puppy and how to have a healthy, well-behaving dog. And I think the Royal College could have menu buttons where people can look things up on vaccinations, on feeding. For example, you could tell people that when it says complete diet, it does actually mean that this is a complete dog diet, and raw is not necessarily better. And there are really so many misconceptions that are out on Facebook and lots of groups now.
Okay. Interesting opinion. Jade.
Hi, Jade Stat, Street Vet. I'm a new fellow, thanks for having me. I guess one of the questions I would say as a new fellow coming into this is, what would the roles of fellows be? Like, to me, I don't know, because I'm new, but in terms of public perception and representing the profession in various things, there's people from all backgrounds here with all amazing skill sets. Surely we could all represent what things for the RCVS in various different ways, having more of a public spokesperson role, I think. So it's a question: what can we do as fellows for the RCVS?
Well, it's a good question that I'm hoping over my time as chair that we can start to answer, but you're absolutely right. Is there a role for us in certain areas? And then if we decide there is, what are we actually going to do about it? But I'm delighted that you're a new fellow and you've just volunteered to take part in that work. So that's brilliant. Kate.
Thank you. Yes, so Kate Richards, Senior Vice President of the RCVS. So I really wanted to pick up the wider point about communicating and messaging to the wider public and what part vets can play in that communication and messaging. Because I think, as has been said, often the first time a new owner that hasn't previously had an animal, the first time a vet might see that, say, for companion animals when they come in for their vaccination. So they've already had the discussions with the breeder, or maybe just the local online network about what breed to buy, and the vet has very little input to that. So it's how the veterinary profession, I think the veterinary profession needs to be part of that, but I don't know where they are in that bigger piece. And also I'd just like to, again, reflect on Saul's excellent presentation this morning as a fellow for the future. It's not just companion animal. So I think there was a collective intake of breath that there are backyard poultry owners who don't even know anything about the avian influenza. So it's across the piece, and how do we play our part in that wider communication message?
Absolutely. Thank you for that, Kate. Rachel, you.
Hi. Is it working? Yeah. Rachel Dean, I work for Vet Partners, I chair their clinical board, and I'm quite interested in evidence-based medicine. So therefore, when you ask about the communication of science, I do believe it is a responsibility for all of us within the professions, the organisations. I share your question, Jade, and I had a lovely chat with Lizzie earlier. I'd recommend it, great boots. But also, if we are the learned crew, I don't know how you qualify for that, but we seem to be sitting here, helping with the technical scientific support of the profession and the public could be a really important role for us, because there is lots of science out there. Science doesn't stop. We should probably stop using the gold standard method, because actually science moves forward all of the time. That terminology should be extinct, because there is no one way of doing everything, and we need to explain that. But also that science doesn't have all of the answers. We need to talk about what we know, what we don't know, and what is a pile of rubbish, and make that clear to enable our colleagues, but also our clients and the public, to obtain good veterinary science and make good decisions based on that. And I think that would be an amazing thing.
Brilliant. Thank you very much, Rachel. We've got one point at the back, but just just pass it back, and then we'll come back to Bradley. So Emma, I hope you're taking notes. We've got a working party forming here, and we've got Jade and Rachel on the list. Yeah, perfect. At the back now.
Myself?
Yeah.
Duncan Berkshire, pig vet again. It's been really interesting listening to this, because obviously we haven't really spoken from a farm animal perspective, but I think there's some very big similarities. The discussion about licensing of dogs, we've kind of almost fallen into that, certainly within production animal medicine for pigs and poultry, where people have to go through various training courses in order to gain their red tractor assurance, for example, and that gives us a base level, looking at our 5 freedoms and stuff, and that's really important. It's not perfect at all. There's lots to move forwards with, and we have lots of behavioural issues within our farm animals. I don't have any experience, personal or professional, of behavioural medicine, but we're very involved with behaviour and how we can impact that. And I would concur with what Emma said, and several people have said, is the fact that as I came into the profession and was a young pig vet, I think I became more and more disillusioned that we as a profession weren't standing up for the welfare of the animals that are in our care. We don't talk about it enough, and so as I've become more experienced and involved, both with policy and all the other kinds of things, I think it is our moral responsibility to be able to stand up and shout more about it, and that's to consumers out there for food-producing animals, it's to owners for companion animals, and very much so for policy, DEFRA, and all of the other bits which come in between. I'm not quite sure how the RCVS fits into that, to be totally honest, but I think we as vets should be pushing ourselves far more and putting ourselves out there as representatives for the welfare of the animals under our care.
Brilliant. Thank you very much indeed for that. I'm afraid I'm going to draw it to a close, because we are getting to our time. And thank you for those comments which brought into mind farm animals as well. And can I recommend a fellow's book, Sean Wensley's book, Through a Vet's Eyes, which definitely gives a really interesting thought of those sort of comments on where we should, as a profession, be standing up about various things that are going on and saying we're not happy with them. So thank you so much for your input. I know that Ben will definitely have really appreciated all the comments that have been made from the floor. And thank you, Ben, for all the hard work that you've been doing on this for a number of years. Other legislation working parties were available. I was aware that one of the past chairs was possibly drilling down on you then when you mentioned just the last one. But the RCVS has been thinking about this legislation, which, let's face it, is getting quite old now, for a considerable amount of time. And thank you for all the hard work you put in. And also, I'd like to thank Deborah and Chloe for scrambling around on this auditorium, which is very steep, and getting the mic to us when we needed it. So thank you very much indeed.